Hi, my name is Diana Reyes, and I'm going to talk about a randomized trial of intraarterial treatment for acute ischemic stroke. Well, what is introduction? In patients with acute ischemic stroke caused by a proximal intracranial arterial occlusion, intracranial treatment is extremely effective for emergency revascularization. There is no evidence providing that intraarterial treatment is an adequate treatment. The method used now intravenous alteplase, which is administered within 4.5 hours after symptom onset. Intraarterial therapy can be divided into chemical dissociation of clots and thrombectomy. Well, this is a video, and we can see the all arteries and veins and how occlude. Material methods. Intraarterial treatment plus usual care will be more effective than usual care alone in patients with a proximal arterial occlusion in the anterior cerebral circulation that could be treated intraarterially within 6 hours after symptom onset. Mechanical treatment, thrombus, retraction, aspiration, white disruption, or use a relative stent. Treatment of acute ischemic stroke with clot retrieval device. This is a video, and we can see the old arteries and how it's circulating in the brain. And this is a zone of ischemia and necrosis. And this is a thrombus, and this is a guide wire, and the microcatheter, and then clot retrieval device for the blood is passed into the muscle. Well, results. 5,000 patients were enrolled at 16 medical centers. There was absolute difference in the rate of functional independence in factor intervention. There were no changes in mortality or the occurrence of symptomatic intracerebral hemorrhage. Primary and secondary results. Primary, there was shift of the ranking scale at 90 days in favor of intraarterial treatment, and secondary, all clinical and imaging secondary outcomes favoring the intervention. And this is a table. We can see the intervention, control, effect variable, unadjusted value, and adjusted value. In another video, American Association for types of stroke, ischemic and hemorrhagic is the principle. And modified rating scales score and discussion or conclusions. Our results show that patients with acute ischemic stroke caused by a proximal intracranial arterial occlusion of the anterior circulation have a benefit with functional recovery when intraarterial treatment is administered within 6 hours after stroke onset. This treatment led to a clinical significant increase in functional independence in daily life by 3 months without an increase in mortality. Stroke prevention and transient ischemic attack. How we can prevent atherosclerosis and hypertension, diabetes, and smoking, and dyslipidemia. There are so many factors to contribute to block the arteries, and this a high risk. Although alteplase is effective along with uric-acid and uric-acid, intraarterial treatment with alteplase is much more effective and decreases the time it takes to be functionally independent. We found that intraarterial treatment in patients with acute ischemic stroke caused by a proximal intracranial occlusion of the anterior circulation was effective and safe when administered within 6 hours after stroke. Thank you so much.